not.
Okay. Let's talk about the other problems with diabetes. You mentioned sexual performance in men.
Yeah.
Diabetes, because I know Viagra is out there and all these herbal supplements to enhance male sexual dysfunction, erectile dysfunction. Tell me about that.
The first question the doctors ask when people just see doctor about their sexual malfunction, do you have diabetes? Because 70% of male sexual problem comes from diabetes. Because the nerve are damaged due to this diabetes. Nerves and capillaries are damaged because of diabetes. So when people take L-lutein, because it's a fundamental problem that give rise to this male sexual problem are solved, they all feel sexually rejuvenated.
So you find the people that are taking, you said over 40,000 people right now around the world are actually taking this product, correct?
Yes.
For those males who had a erectile dysfunction problem, in many cases, they've seen some positive results there as well?
Yeah, unlike Viagra, that positive results remains there.
Oh, the results remain as opposed to Viagra, which is a one-time...
Yeah, and the Viagra has some serious dangers, you know that, right? It squeezes the artery, but this thing cleanses the artery and make the nerves healthy again. So we didn't intend, when we were developed, we didn't intend for this purpose, but that's the testimony we hear most frequently.
Well, if it's balancing out your blood sugar levels, I mean, it seems to be bringing your body back to a state of normal.
Yeah.
What about other issues like weight loss?
Yeah.
When I talked about Dr. Atkins, I mean, he just passed away recently. He slipped in front of this, he slipped on ice in front of this clinic and died. That's a horrible, horrible thing. But Dr. Atkins always talked about the insulin levels in the blood affecting weight loss.
Yeah.
When people take this, have you noticed anything in relation to that?
Very important. Actually, Dr. Atkins must have raised a very important point. With this product, the efficiency body uses insulin goes up. Therefore, the insulin inside the blood actually goes down because it's used more efficiently on the cell level. Therefore, this thing controls the appetite too. So,
but there's no physical double-blind studies on controlling appetite. That's your opinion or on what you've observed that it appears to control the appetite, correct?
Yeah, but the American experts just have a look at this. I think I can mention the former president of American Diabetic Association had a look at this product and then he recommended it and he gave a friendly personal advice that we should develop this as a weight loss product rather than diabetes product, 10 times larger the market.
From a sales standpoint?
Yeah,
but
he just gave you advice as a friend.
So you think it will, you think based on what you know, that if somebody has a weight loss problem, well, number one, anybody who has diabetes, it may become easier for them to lose weight if they take this. But if somebody does have a weight loss problem, maybe without diabetes, if they take this, do you think potentially it could help?
Not only potentially, evidently. We recorded that part of the statistics very systematically. There is obvious dropping of weight loss, but not only that, the weight loss induced by this product seems to stay there for a long time, different from other diet or weight loss programs.
Well, it seems that would go along with Dr. Atkins' theories about insulin levels in the blood and so forth. You know, he controlled the insulin levels through diet.
Yeah.
And this is an herbal supplement that can control it as well.
Yeah, so he controls the insulin level, right, with the diet, right? But this thing controls the efficiency of the body that uses insulin. So I can use the analogy of the engine of an automobile. This thing as engine becomes newer, younger, so that it just burns the fuel more efficiently rather than controlling the fuel level itself.
What about prevention? I just had a whole bunch of blood work done. And they told me that I don't have diabetes, although I'm at the higher end of the scale. What about prevention?
Usually, when people are diagnosed with diabetes, 7 years ago it started. So prevention...
7 years ago it started?
Started, before the diagnosis.
So when they were diagnosed today, I have diabetes, but they actually had it 7 years ago.
Yeah, started. But so this one have the proven effect of rejuvenating beta cells, proven effect of upregulating the efficiency of insulin use. So this thing obviously has the preventive effect.
Now, when you say proven effect, I mean, are these scientific, documented studies that have been published in medical journals, or are these just initial reports?
Oh, there are reports in medical journals, yes. The people, but going back to this preventive, well, we tested on animals. So we made animals to have diabetes in the future, and then we have the control group study. Animal treated with L-leotine do not develop diabetes even though they were made to have diabetes.
So if a person doesn't have diabetes now as a preventative, as well as other potential side benefits, such as energy increases,
yes,
eyesight, you mentioned, weight loss, appetite control.
Yeah, I have, the personal testimonies all around me. The people come and say to me, Dr. Kim, I didn't see, but now I see. So, and then, the 60...
Well, it's not a cure for blindness.
But it helps.
Well, it seems to help if the person had a diabetes problem which affected the blindness.
Yes.
Hold on, because I have a lot more questions about actually what it does to the pancreas.
Yes.
If you're watching right now, we're talking with Dr. Young-Soo Kim, PhD from MIT, who discovered this herbal supplement for type 2. Does it handle type 1 diabetes as well?
Yes, but we don't still have no case of type 1 diabetes who became completely cured.
Okay, so
but for them, usually they reduce the insulin requirement by 60 to 70%.
Let's talk about, since it's not a drug, you can't make the claim that it cures diabetes.
That's what I understand about the American regulation.
So it's a food supplement.
Yes.
But the food supplement seems to, based on the initial reports, have an effect on regulating the blood sugar levels.
You can remove the part seem to. It does.
It does.
It does.
It does.
It does.
It doesn't in 100% of the cases.
Don't say seem to.
But it doesn't in 100% of the cases.
98%. But those 2% who don't experience the drop in blood sugar, they all have already serious liver problems. So for those people, any herbal product will increase their blood sugar. So it is not a matter of L-leotine. People with serious liver problems when diabetes advances, for them, any herbal product releases huge amount of blood sugar from their liver.
Right.
So except for those people, this doesn't seem to drop the blood sugar. This does drop the blood sugar.
The pancreas in a diabetic is just, it's not producing enough insulin. Is that correct?
Yes.
Now, how does this solve that problem? It seems like the pancreas isn't working correct.
Yeah, for two reasons. One, we have the proven science which shows that L-leotine increases the number of beta cells itself. Secondly,
it increases the number of beta cells.
Yeah.
Now, what is it? What are the beta cells?
Beta cell produces insulin.
Okay.
And then on the top of that, this thing also is proven to help beta cell secrete more insulin. So, because of that effect, because we are talking about molecular level changes here. Once this thing starts, it doesn't stop overnight. That's
Even if you stop taking the product, it seems like it seems like the benefits could potentially carry on.
I think that's why the effect of L-leotine stays years, months, even though they stop this treatment.
And these studies, as you mentioned, have been going on for over 20 years, correct?
Yes.
What about energy levels? I mean, a lot of diabetics, I was at a spa, a Golden Door Spa out by San Diego, and there was a fellow there by the name of Brian Coughlin, a friend of mine who lives in the Cleveland area. Very successful guy, very strong, big guy, diabetic. By looking at him, I don't know what a diabetic looks like, but he was, every time he had a meal, he was taking his blood and looking at his levels. And he had all these types of concerns and problems. He was always checking, the blood levels. So if he started taking this, after 2 or 3 months after taking that, you think that could potentially be regulated so he wouldn't have to start pricking his finger every time?
I hope so. But the people after people, they testify to that.
And energy levels, is that normally increased with individuals?
Yeah, without exception. It's like
Well, there's got to be one exception. I mean, there's got to be a couple people that they don't see. Okay.
Personally, I've never met.
Okay, personally, you never met. But there could be somebody who doesn't have a dramatic increase in energy.
I want to meet him.
So you think
let's call him.
You actually believe that everybody who takes this, their energy level is going to dramatically improve. I mean, chronic fatigue syndrome is like a major problem with people who are always, you know, drinking coffee to get up, and they wake up tired. They have no energy. Everybody's always tired.
It's like a fuel system of a car. Because of the old lazy engine, doesn't burn the fuel. But if you fix the engine, of course car runs faster and with more power, right?
Are more people today getting diabetes than ever before?
That's correct.
Why do you think that is?
Lifestyle. That we eat a lot more food than before. And even the same food, we have a lot more calories in the same quantity.
Eating a lot of sugar, is that a problem for diabetics?
It aggravates, but it doesn't seem to start the diabetes. It aggravates, yeah.
Because obviously we're eating a lot more sugar today.
Yeah.
I've read
once you eat a lot more sugar, it tires pancreas. So it indirectly induces these beta cells in pancreas getting tired too early, and they stop functioning. So we call it as indirect environmental reasons for diabetes.
Now, why is it better for someone to take this, for example, like my dad? He takes insulin shots. He seems to be seems to be controlling his diabetes. Why would it be better for him to go on this than continue to take his insulin shots?
That treatment, you have to continue forever, and then you have to increase the treatment because the body develops resistance. This product, L-lutein, you use it for 5 months, and then you can stop it, and then you don't need those treatments either. So we are not talking about two things on the same level here.
Well, a person certainly would have to consult with their doctor to make sure everything was in place, and I'm sure there's going to be some people where after 5 months of taking it, they're not going to see the results that you've seen in the majority of cases.
Yes, but it is very important to see a doctor before they stop their traditional treatment.
Right. Because, yeah, I don't want my dad to immediately stop taking his injections.
People feel like so because they feel a lot more energy.
Right.
And then they feel a lot better. So people feel like so, but I want to repeat that it's very important to see the doctor before they take off their traditional treatment.
And other problems with diabetics, again, for the people out there, for example, like myself, who I'm not a diabetic, but I get my blood tested all the time, and those sugar levels have been slowly increasing over the last few years. This would be something I should take as a prevention.
Exactly. For example, you have a parent who has diabetes, right?
Yeah.
And you see this slow increase in your blood sugar level. I think you should take this.
So you think of, yeah, well, you know, it's interesting. As we get older, it's harder to lose weight, so this potentially could make it easier to lose weight.
Yeah.
We're tired, more tired, so this potentially could increase our energy.
That's correct.
My eyesight's getting a little worse and worse. This potentially could help that as well.
If that deterioration of eyesight is caused by diabetes, I can definitely say yes. But if it is caused by something else, I cannot say that.
Dr. Young-Soo Kim has been my guest, PhD, MIT. Thanks very much. We're going to have you back on again. I'm Kevin Trudeau. You've been watching A Closer Look. We'll see you next time. Bye-bye.